In this segment of the gross anatomy, we're going to explore more on the gross structure of a typical long bone. A typical long bone consists of three parts: a shaft or the body and two ends. The shaft is an elongated part between the two expanded ends. It is made of an outer thick shell of compact bone or the cortex, enclosing a cavity called the medullary cavity, thus providing maximum strength with minimal weight and material. The medullary cavity is filled with yellow bone marrow. Remember that at birth, it is filled with red bone marrow and is involved in active hematopoiesis. The ends are knobby and largely made up of cancellous bone, covered by a thin shell of a compact bone. The ends of the long bone are covered by an articular hyaline cartilage and takes part in the formation of joints. Now let's learn about the in and out of the bone, the periosteum and endosteum. The outer surfaces of all the bones are covered by a thick fibrous membrane called the periosteum, whereas the inner surface are lined by a thin fibrous membrane called the endosteum. Both periosteum and endosteum contain osteoprogenitor cells, the osteoblasts, and the osteoclasts, which are essential for bone formation, remodeling, and the repair. The periosteum is a thick fibrous membrane covering the entire surface of the bone, except at the areas covered by an articular cartilage. At the articular margin, the periosteum is continuous with the joint capsule. It is made up of two layers, the outer dense fibrous layer and the inner cellular layer, which is osteogenic in nature. The periosteum is united to the underlying bone by extrinsic collagen fibers called the Sharpey's fibers. These are coarse collagenous fibers from inner layer which extends inwards to penetrate the bone matrix, which is the outer cortical bone tissue. It so occurs like the spikes of a shoe, thus bolting the periosteum to the bone. The endosteum is a cellular membrane that lines the medullary cavity in the shaft. The osteoblasts and osteoprogenitor cells within the endosteum play an important role in bone remodeling and repair. The nutrient foramen is usually present near the middle of the shaft for the entry of nutrient artery. Functions of periosteum. The periosteum protects and maintains the shape of the bone. It nourishes the outer part of the underlying cortex by abundant periosteal arteries. It also provides attachment to ligaments, tendons, muscles, and intermuscular septa. It provides regenerative capability to the bone. Clinical correlation. The periosteum is important in the repair of fractures. It has unique capability of forming new bone. Hence, the bone stripped of its periosteum will not survive. The periosteum is very sensitive to pain, particularly to tearing and tension. Therefore, drilling into the bone without anesthesia is very painful. For the same reason, during intramuscular injection, if needle penetrates the periosteum, severe pain is felt by the patient. The parts of growing long bones. A typical long bone develops from a preformed model of hyaline cartilage in three parts: the two ends and an intervening shaft. The two ends are formed by secondary centers of ossification, and the shaft is formed by the primary center of ossification. Before the ossification is complete, the following parts can be defined in a young long bone: the epiphysis, the epiphyseal plates, the metaphysis, and the diaphysis. The epiphysis are ends of long bones which ossify from secondary centers. The epiphysis are the following four types: pressure epiphysis, traction epiphysis, atavistic epiphysis, and aberrant epiphysis. Pressure epiphysis. This type of epiphysis is covered by an articular cartilage and takes part in the transmission of body weight, like the head of the femur, or the humerus, or the lower end of the radius. Traction epiphysis. It is produced by a pull of the muscles or a single muscle, like the greater and lesser trochanters of the femur, or the greater and lesser tubercles of the humerus. It is always non-articular and provides attachment to the muscles or a single muscle. It always ossifies later than the pressure epiphysis. Atavistic epiphysis. This type of epiphysis is an independent bone in lower mammals, which in man gets fused to the nearest bone to achieve nutrition from the host bone. It grows like a parasite. Some of the examples include the coracoid process of the scapula, the posterior tubercle of the talus, which is also known as os trigonum, the aberrant epiphysis. This is an epiphysis which appears at unusual ends of a short, long bone. Example: epiphysis at the head of the first metacarpal. Remember that normally the epiphysis appears at the base of the first metacarpal bone. Epiphyseal growth plate. Epiphyseal growth plate is a plate of hyaline cartilage which intervenes between the epiphysis and diaphysis of a growing long bone. The proliferation of the cells in the epiphyseal cartilage is responsible for the growth in length of a long bone. After the fusion of the epiphysis with the diaphysis, the bone can no longer grow in length. The epiphyseal plate or cartilage is nourished by both the epiphyseal and the metaphyseal arteries. The fusion between the epiphyses and the diaphyses occur at least 2 or 3 years earlier in females, hence they are a bit shorter in length than males. Metaphysis. The end of the diaphyses towards the epiphyseal cartilage is called metaphysis. It is the most actively growing area of long bone, and before the fusion of epiphyses, the metaphysis is profusely supplied by blood from the nutrient artery, the periosteal, and the juxtaepiphyseal arteries. These are end arteries and form hairpin-like bends. Therefore, metaphysis is a common site of osteomyelitis in children from bacteria and emboli that are easily trapped, leading to infarction. After the epiphyseal fusion, the communications are established between the epiphyseal and metaphyseal arteries. As a result, metaphysis contains no more end arteries after fusion. For this reason, osteomyelitis in this region is rare in adults due to the formation of collaterals. Diaphysis. The diaphysis is an elongated part of the bone between the metaphyses. It develops from the primary ossification center.